Hello again, everyone. Welcome to another edition of Odyssey House Journals. I'm Randall Carlisle, along with my co-host Rachel Santizo.
Hello.
And this is, when you watch this, it may not be in May or listen to it, but we're recording this in May, and May is Mental Health Awareness Month. And so we're sort of focusing on mental health awareness. So our two guests are Anna, and I'm reading from this because you gave me Anna West she's the Workforce Development Coordinator for PCRH, which I had to look up, Primary Care and Rural Health. Okay, nice. So welcome, Anna.
Thank you.
I'm glad you actually sent me this information. And Megan Neuf, did I say that right?
You did.
Okay,
Nice.
and you work for, we all refer to it in the industry as AUCH.
Yes.
Right?
Yeah. But you got to spell it out.
Yeah, well, it's the Association for Utah Community Health.
Mm-hmm.
So if you look at it, it's AUCH. So
We are ouchies.
ouchies. So we have an ouchie with us and a state worker with us. And you guys have any short terms for that?
Public servant.
Okay.
Okay.
So we have a public servant, we have an ouchie, and then we have Rachel and Randall.
Yeah, Rachel.
Well, we thank you for joining us. And you may be listening on a variety of platforms, or you can watch this on YouTube if you just Google it, Odyssey House Journals. So what do you want us to know, since it's Mental Health Awareness Month?
Well, we wanted to talk today about challenges in getting mental health care in rural communities. So one of our primary efforts is to make sure people in rural communities can get access to a psychiatrist, a therapist, and other types of providers.
And the information you sent me, I mean, our state only has how many people in it? 3.5 million, something like this. And what you sent me, you said 3 million people are underserved. So that'd be pretty much the state.
Almost everyone. Yeah.
And when you mean underserved, what do you mean? I want help, I can't find it?
Underserved would mean that there aren't enough providers to meet the population's needs. So there's some kind of like dual ratios of how many people per psychiatrist, per mental health therapist, for people to be able to get an appointment when they need it. Essentially, it means that there just aren't enough people to provide the services. They may be too far away. There might be even mountain ranges or something in the way between them and the provider. So we look at geographic barriers, we look at distance, and we also look at like special factors like, are there children's psychiatrists? Are there recovery professionals? Things like that.
People to prescribe as well is a big, people who are able to help with psychiatric medications, like psychiatrists. Really important, but a huge shortage, not just here, but nationally.
Well, and even in the metro area, what people don't, I mean, like just speaking on behalf of Odyssey House, we have maybe 30 open positions. And what people don't realize is we may have bed space, but if we don't have staff, then we can't bring people in. So, you know, and that frustrates us sometimes in administration, because we'll hear we've got 20 open beds, and then admissions will say we can't admit anyone today. We'll go, why? Because we don't have staff. I mean, you know. So what does AUCH do in around the state? Because you're pretty robust in providing services.
Yeah, so we don't provide any direct care services, but we serve as a representative of all of the community health centers in the state, or most of the community health centers and affiliate members, which Odyssey House is an affiliate member. And so we provide technical assistance to all of the health centers in terms of things from quality improvement to workforce. And so because workforce is such a high need in healthcare, that is something that that our funders from the federal government have said, you need to have somebody who is just focused on this all the time. And so Anna and I really get to play kind of the same role, but in different organizations of helping making sure there's enough providers, not just in mental health, which is a very high need, but across all kind of medical professions.
Yeah, mental health is one of the biggest. We also look at prescribing medication-assisted therapy, making sure there are providers for that. But another area of interest that we'll be talking about more this summer is care for reproductive health needs as well. So there's a lot of different shortages.
Mm-hmm. Why do you think there's so much shortage?
I think, because last week we had Dr. Baez in
Yes.
from Davis Behavioral Health, and he brought up the fact that people working in mental health are pretty much not compensated as well as people with the same skills working in a different area.
And yet the level of responsibility
Huge.
is huge. I mean, life and death sometimes. So it's a hard thing.
Yeah, I think it's a high burnout sort of career path as well. You really, as an employer, have to make sure there's a ton of protective factors to keep people
Sure.
healthy. You need your workers to be healthy to be able to serve people in the best way. And so you see a lot of turnover in that, as you spoke to, compensation as well. And then I think just generally, as boomers retire, and we're seeing those kind of shortages impact the mental health sector as well.
No.
Everyone should retire.
No, you're right about that.
Self-care is important.
And Dr. Baez last week had such an amazing attitude about what he does, because he said, I wake up every morning and I'm happy because I get to go help people, but the people he's helping have significant issues. And so some people who work in that field, go home every night and go, oh, God, did I make a difference? I'm depressed. I don't know how much longer I can do this. So it's a tough field.
I think that among our listeners, there may be budding mental health professionals listening. So I want to kind of shine a light on. Yeah.
No, you're absolutely right. There's a ton of people who are either thinking about seeking recovery or in recovery or or in long-term recovery.
And that lived experience is often something that sparks people to want to go into a social work, psychiatry, psychology profession.
Peer support,
Case
support. Management. Yes.
Yeah, which is incredible to see. So we really are interested in that pathway, sort of from lived experience to the professional experience. And we offer some different incentives so that, if, say, you're in recovery, you've possibly just spent a lot of money to get sober. Maybe you're living in sober living or whatever. Taking out student loan debt might feel overwhelming. And so we want people to know that there are scholarship programs. Those are offered federally. There are student loan repayment programs. So that's what I work on specifically. So someone graduates, all they have to do is get a job in a shortage area, which we can tell them what those shortage areas are. It kind of gets complicated. And then sign up for our program, make sure they're eligible, and we'll help them pay back a good chunk of their student loans if they commit to serving that community that needs them the most. So there is kind of some brightness on the horizon for those folks. And I don't want to discourage any listeners from going into this really important
and
profession.
I don't mean to either.
Yeah.
It can be very rewarding.
Incredibly. And like Megan was saying, as long as you get those protective factors lined up and, the support you need, the supervision, I think there is a lot of reward. It may not be entirely financial reward.
Absolutely.
No, it's not. And so you're saying somebody who is going through a treatment program and graduates or whatever and wants to get into the field, how do they find out what help is available? I mean, at Odyssey House, we make it a benefit and we list the contacts for people who want to do that. But how somebody just listening or watching, where do they go?
Well, it's going to kind of depend on their background, their educational background, and their interests. So if they've never gone to college at all, I'm going to just put a little plug in for my college, Salt Lake Community College. It's a great place to start.
Which Rachel is a success story.
Rachel's one of my students, in fact.
Really?
Yeah. So
what kind of grades did you get?
You already know that because she's sitting here.
Yes.
Award-winning student right here.
Yeah.
We still use her papers as examples
Really?
to other students.
How about
You
that?
already knew that. Thank you. So Slick is a great place to start, although I'm not really here to talk about slick as much.
Yeah, but if people do want to start, because a lot of people think in recovery, they said, okay, I want to start improving my life. And one thing is education. So and SLIC's a great place.
You know, you would declare a major, you can transfer to a school, get a social work degree. And at that point, you'll let us know, and you can look on a website called 3RNet for jobs in shortage areas. And then you'll let us know and we'll help you with loan repayment. So we don't want folks to think I can't do this profession at all because of the amount of debt. There are options.
And then another pathway, if you're like, I'm not sure if I'm ready to commit to something like social work. At AUCH, we also house the Utah Healthcare Corps, which allows AmeriCorps members. We have lots of community health workers. This is primarily a community health worker program, but one of the subsections of that is an AmeriCorps program that actually allows people to come in. They can do it while they're in school, and actually count some of their school time towards their AmeriCorps time. And at the end of that, you get an education stipend that you can use to pay off old student loans, that you can pay on current education, or you can save for several years and kind of put towards your education when you're ready. And you can do multiple consecutive terms of that and kind of bank up some more of that money as well. So kind of get your feet wet in the system. That could be a good option for people.
Yeah. We had an AmeriCorps person work for us, and she became our harm reduction specialist for a while.
Amazing.
And now I think she's working for the state now.
She's like our AmeriCorps Vista. She's probably running the world
right now. Yeah, it's a great program.
We're talking a lot about barriers, right? And education and stuff. And I know not all, but some of the population has criminal backgrounds. And that can prevent people from even wanting to look into schooling, employment, giving back. And so what would you say to those individuals right now that may feel discouraged?
I'm looking at Megan because I don't know all of the criminal background checking processes for every mental health profession. Yeah. But I know that there are ways to get involved, even if it's as like through a 12-step program. Going to 12-step, being a sponsor, there are careers, correct me if I'm wrong, with substance abuse counseling. Many substance abuse counselors have a criminal background already. There's also a new program that's working to help people clean up their background. So
clean slate. And RASA. So, and if you just if you Google clean slate, if you happen to be somebody out there, if Google clean slate Utah, and it'll ask you a couple questions like, how many offenses you have, are they felonies, misdemeanors, how long have they been on the books, and they'll tell you whether you're eligible for expungement. And a lot of people don't know that they are, which makes a big difference. And a lot of employers, I think, are becoming a lot less stringent upon whether you say, okay, I was busted for a drug offense 6 years ago, and even if it was a felony, the point is you've gone through it, you've made all these changes in your life.
I think that as employers value lived experience more and more, we're doing more and more justice and equity work as professionals. I think we're going to see that trend continue where we understand that people can go through a hard time, recover, and bring that lived experience as an asset.
I'm curious, why are you so passionate, both of you? Why are you in this field? We're talking about a field that is lacked, but yet we're all here. So
that's a good point. Are we all dumb?
Why are we here today?
So I was always kind of drawn to this field. I think from the time that I was pretty young, like say middle school, I started to kind of get involved in advocacy and social justice. Just a very young age. I feel like I came from a pretty privileged background. Not everything was perfect. I definitely have some grandparents who were either in recovery or who had some substance challenges over the years. But, I came from a place where I had everything that I needed. And I just felt like everyone in the world deserved that. And so I kind of had that drive from a very young age to just make sure that what I did with my life was something that made sure that people had access to what they needed, whether it's healthcare or other services, people just deserve to be treated with dignity.
Are you still glad you made that decision?
I am still glad. I'm about 10
I'll
years
check in
into
with you
working.
20 years from
Yeah,
now.
exactly.
I'm about 10 years in, and I'm still here. I'm
Cool.
still fighting the good fight. So talk to me in another 10 years,
Yeah.
and we'll see.
I'll be dead, but somebody Rachel can ask you. So, and how about you, Anna?
So my background with this topic is maybe a little bit more lived experience. I'm from a rural area. I've had to go to seek medical care in a community with, no providers. And frankly, it was easier to get into the veterinarian a lot of the time. So that's, I know it sounds so funny, but that's kind of my childhood emergency contact was the vet.
I have suicide ideation, Dr. Vet. What should I do?
I think we more like had hay in the eye.
No.
And then.
But you really did have trouble seeing a doctor.
Yeah.
When we live in a metro area like this,
Yeah.
it's hard to imagine. But if you think of the size of our state and that people live all over,
Yeah, it could be absolutely hours away.
So
yeah,
continue.
and
I didn't mean to interrupt.
oh, that's
Yeah, I
okay.
did.
And so I have kind of that lived experience, and then I'm a teacher. I teach students who have been incarcerated or who are not U.S. born or literacy issues, and a lot of my students have had lived experience around substance use disorder, and I have as well. And just seeing them recover and contribute, it really makes you, it reinvigorates you. So I've got about 25 years in public health, and I don't know if I would still be doing it without my students kind of breathing that air of life and freshness into it for me every day.
Well, and Rachel's a fine example, because she's gone on to excel and worked at Odyssey and USARA and FTR, which is where you are now, and is recognized as really a leader in the recovery community.
Yeah.
So that's rewarding to you.
Very,
because,
incredibly.
Yeah.
You got to stop.
That reunited, and it feels so good.
Totally.
And at places like Odyssey House or any other treatment center, we have a lot of failure, but we have a lot of success.
Yeah.
And so you have to sort of look at the success in terms of sticking with what you're doing as a profession.
I think it helps to look at those failures as setbacks and relapses and to just continue to try to believe that tomorrow's a new day. We can try again.
And the really sad thing is when you see an obituary and it was somebody who went through your program and they died from an overdose. And it's just, it's sad.
Yeah.
And it happens quite often, like in this.
Almost once a week.
Yeah, in this world, I mean, it's miracles and tragedies in one day, and so it's that motivating factor that there's still a lot of work to do. Like you two ladies sitting here today, there's still so much work to do.
Yeah, and we hope others want to join us and kind of join this battle against all of these social problems and bring more providers into these underserved areas.
It is really a battle, and I don't know how many people read about it, but every single day there's something new. There's some new drug combination like tranq and fentanyl in a heroin shot that causes your skin to go dead and kills people, and it's just
Yeah, if I can suggest another solution, and this is something that if there's any employers listening, parents, teachers, is if we can create a caring culture and try to reduce the amount of trauma experience that people have, that can hopefully help prevent some of the feeling that you would rather, inject yourself with something that can really hurt you to get a break from reality. If we can prevent the trauma that causes that need to escape.
What is a caring culture at a company?
Great question.
You throw that word out.
Factors.
Good question. Yeah. Do you want to talk about it, or do you want me to?
At a company, I think that it is.
Well, she said employers.
Yeah. I think that it is having open communication and an open door, that if somebody is experiencing a challenge, of being able to recognize and support them in that, and understand that people come to work every day, not just as your employee, but as a real full human person who has baggage and has all sorts of things. And if we can kind of support that, I think we can do better work. and make sure that people have the resources available to them, kind of whether it's in crisis or kind of as preventative things. I think EAP programs, employee assistance programs, really important to have, and a lot for those who are in the Wasatch Front. A lot of Select Health has an EAP program. A lot of people have that insurance plan, so you can get some services through them.
And if someone has a job where they're not insured, a community health center would be a good option if they do need that kind of support.
There's 14 of them around
There's
the
14
state?
across the state, in both rural and urban, and frontier. And all of them as community health centers, they're one of the first kind of places to provide what we call integrated care now, but I don't think that's what they called it kind of when the health center movement started. So they're required to provide access to mental health, behavioral health services in our communities. So it's a really good place to start.
An example of what clinic where? Is 4th Street one?
4th Street is one.
Okay.
So there is, I'm going to call out the Carbon Medical Services Association in Carbon
Price.
County in Price. So they provide, they have something like 5 mental health providers on staff. They even do trauma therapy. They do EMDR. They have somebody who is trained in kind of like sexual health and things like that, like a mental health specialist who's trained in that area. And then they also provide pretty robust MAT services there. And you can see your primary care provider. The primary care providers are often the ones who are providing the MAT services.
And Price was a horribly underserved area when it came to substance use treatment. But it's getting
so they're
better.
doing some really amazing work there.
Cool.
Just to clarify, MAT is medication assisted therapy. This would be like your buprenorphine. Typically, it might be methadone. What's that?
Vivitrol.
Thank you.
Yeah.
Vivitrol's the one
We're
I
like,
couldn't
we're big on the Vivitrol.
Yeah. So that that helps people, on their journey towards sobriety.
We have about 5 minutes left.
Okay.
What do you think are the important messages that we should be getting out in this podcast, because it is Mental Health Awareness Month?
Yeah.
Well, my first most important message is treat each other as well as you can. And another tip I have for employers is appropriately sharing that you have struggles too can be something that reduces trauma in your staff. And then our website, which is ruralhealth.health.utah.gov. So if you would like to learn more about loan repayment programs, if you're on a pathway to becoming a provider, or you already are, even if you want to be a community health worker, a medical assistant, come check us out. We also have a shortage of dental hygienists that we're working. We don't have a program yet, but we're working to provide that kind of service to help those professionals.
Yeah. And similarly, if you're interested in accessing the services of a community health center, you can go to AUCH.org. That's AUCH.org.
Ouch.
Ouch.
And
they
don't
you can
hurt
find
people, they help people.
Yeah. You can find a community health center through our website, and that you can call them and ask what types of services that they provide. If you're interested in employment, you can reach out to me, and I can kind of help to connect to people who might be looking for whatever it is that you're interested in doing. Or if you're interested in our AmeriCorps program, happy to connect you to our AmeriCorps coordinator. So just reach out to me. You can find me on our website as well, and get my email, and I'm happy to support people.
I would love to know real quick. You talked about protective factors.
Yeah.
Can you just name off a couple?
Oh, this is a quiz. Okay, so protective factors could be things like social support, making sure that you have good supervisory support, that in crisis there's some sort of protocols about how to kind of do a debrief, pull everybody together, or they can be personal things as well, so mindfulness, meditation, and things like that.
Great.
That you can kind of help bring yourself back down to kind of normal functioning level from elevated
What about
crisis
kids?
situation.
I mean,
Yeah.
teenagers, we keep seeing growing numbers that they're all that they're suffering from a lot of mental illness. So what can we do? I mean, is it because of social media and interaction on phones and things like that, or is it because it's harder growing up now? I don't know.
Yeah.
Right?
I think that's a hard question to answer.
Well, nobody's
but,
answered
yeah,
it.
but
Yeah,
but I know that if parents are concerned about their teens, again, I'm going to plug community health centers. It's a good
Sure.
place to go to at least kind of get screened and see it and try and catch things early. I think that preventative care and talking about mental health with teens, I think we can't be afraid to have those conversations with our children. I have those conversations now with my 3-year-old about recognizing when we're having big feelings and that it's okay and how to work through that and trying to help her with those coping mechanisms. We just have to be able to talk about it and catch it early.
Yeah, and for the adults to take care of their mental health so that they're setting a good example, that's helpful. I think each of us has things that we know work for us and really focus on those positive assets that you have, whether it's, like for me today, getting to see Rachel and be with you all. That's something I can really savor all week that will help build my resilience. And so by doing that for ourselves, we learn how to do it for other people.
I think one thing I've noticed in the recovery community is we do a lot of hugging. We're happy to see each other and that we're still in recovery and we haven't relapsed. And it's a loving community to get into.
That's a protective factor right there, is to know you have a loving community around you. Social isolation is a big risk factor in recovery and for anybody.
Yeah, another good one is exercise, and Rachel's running one of our.
That's why she looks so fit.
It's true. That's another protective factor, and I want to call out the services Odyssey House provides too, and that expertise. And I'm sure you can, even listening to this podcast and getting those takeaways, would be things that would be health promoting, mental health promoting.
And I think being on the other side, so being in that profession, giving that safe space to be vulnerable, like to be real with what you're going through. So for instance, ours was education, and I was able to just be me. I talked about my substance use disorder, the lingo that we use. And so providing, if you were in that profession, providing safety for what people may go through or what may feel. So we normalize that instead of shaming it.
Exactly.
It's a big thing. And I know that that's what you provided for me.
Thank you.
So,
and people are more willing now to, when years ago, like 100 years ago when I was growing up, if there was somebody in the community who was an alcoholic, they'd say, well, he just drinks a lot. Or like when a teenage girl would get pregnant, they would send them out of town to some other place to have a baby. So there's just not, we're a lot more honest now. And I think that's good.
Yeah.
So.
Yeah. And that may be part of why our rates are going up, is people are telling the truth.
Yeah.
About how they feel.
Yeah. I don't really know that depression and anxiety are any more common now. I think it's that just people have the skills and tools to recognize it. And have words to talk about it.
I think you're absolutely right on that. Well, we're out of time. Thank you very much.
Thank
Megan
you. This
and Anna
great.
and Rachel. Good to see you all again.
You too.
I'm glad you got good scores from your professor.
Thank you. It's all being vulnerable right here on the table.
I hope you enjoyed watching or listening to another edition of Odyssey House Journals.